The spinal cord is an important part of the central nervous system, and the vertebral column is critical in providing support for the entire body. Today we will discuss the location of the spinal cord and nerves in relation to the vertebral column, along with consequences of injuries to the vertebral discs and variables that differentiate cervical, thoracic, and lumbar vertebrae.
In each individual vertebrae, there is a circular opening between the body and vertebral arch, which is called a vertebral foramen. When the vertebrae are stacked in a vertebral column, the vertebral foramen line up to create a vertebral canal, in which the spinal cord and roots are located. On the lateral view of two adjacent vertebrae, the superior vertebral notch and the inferior vertebral notch can be seen to form the intervertebral foramen. The intervertebral foramen holds the spinal nerve.
There are many ways in which an injury to the intervertebral disc can occur. The intervertebral disc weakens substantially with age, which can cause them to rupture or break during strenuous activity, such as lifting a heavy object, through trauma, or through awkward motions in the torso, such as losing balance. In the event of an injury to the intervertebral disc, the annulus fibrosus, which is the outside and most superficial layer of the vertebral disc, consisting of fibrocartilage, is broken, allowing the inner gelatinous nucleus pulposus, which usually absorbs shock, to bulge out. This is called a herniation. Ligaments holding the spine together prevent the nucleus pulposus from bulging out anteriorly or posteriorly, a reason most herniations are posterior lateral. The excluding nucleus pulposus and resultant absence of it in its cavity can compress the spinal cords or spinal nerves, causing pain and sometimes muscle weakness.
There are three types of vertebrae in the human skeleton: cervical, thoracic, and lumbar. The vertebrae are physically different in many aspects due to the differences in location and primary function. The cervical vertebrae is the most superior, followed by the thoracic and lumbar vertebrae. Body shape and size, vertebral foramen shape, transverse process appearance, and spinous processes appearance are characteristics used to differentiate between the three types. The cervical vertebrae is especially unique in that some of the vertebrae are atypical, which means they possess unique features no other vertebrae have.
The cervical vertebrae are small and oval-shaped, with the exception of C1, an atypical vertebrae that lacks a body, and C2, an atypical vertebrae which has a projection called the dens on the superior surface of its body, which allows the neck to rotate.
The thoracic vertebrae are larger than the cervical vertebrae and are heart-shaped. They all contain costal facets which articulate with the ribs. The lumbar vertebrae differ as well, as they are the largest type of vertebrae and are kidney-shaped.
The vertebral foramen shape differs in all three types of vertebrae. The cervical has a triangular-shaped vertebral foramen, while the thoracic vertebrae has a circular vertebral foramen, and the lumbar vertebrae has a flattened triangular vertebral foramen. The transverse processes appear different in all three types of vertebrae as well. The cervical vertebrae contains transverse foramina. The thoracic vertebrae have long transverse processes which contain articular facets for ribs, and the lumbar vertebrae contains short transverse processes with no facets or foramina. The spinous processes differ in all three types of vertebrae as well. The cervical vertebrae have fork-shaped spinous processes, with the exception of the atypical vertebrae, C1, which lacks a spinous process. The thoracic vertebrae have long spinous processes, which point inferiorly, while the lumbar vertebrae have thick spinous processes, which point posteriorly.
The vertebrae are stacked to create a vertebral column for the spinal cord and its roots. Injury to the intervertebral disc can cause them to rupture, break, or herniate, resulting in pain or more serious complications. There are three types of vertebrae: cervical, thoracic, and lumbar. each with unique features that provide support and attachment for much of the human skeleton.